Hey, welcome to Healthful Conversations with SSM Health. I'm your host, Julie Tristan. I'm so excited this month. We are talking to Dr. Heidi Sally, SLU Care Pediatrician at SSM Health, Cardinal Glennon Children's Hospital. And we're talking about helping kids transition back to school during the pandemic. This is going to be a great conversation, Dr. Sally.
Absolutely. Really important topic at this time of year.
Okay, first question. Transition in a time of physical distancing, we have masks, extra stress, super hard. So what can parents do to help support their child's transition back to school?
Yeah. So especially if you've been really good about kind of staying at home already and the kids aren't maybe as used to wearing masks or used to being out in public or in public areas or with a group of people, that can be a big deal for them. So first thing I would suggest is maybe some practice, making, just wearing the masks for a little bit of a time each day and maybe extending the time a little bit longer because a whole day is a long time. I wear a mask all day and at the end of the day, my ears are a little sore and sometimes I'm just tired of having it on my face. So, working the kids up to that, especially the younger kids. Also just talking to them about the positive aspects of wearing a mask. And it's not just coronavirus, honestly. It's going to help keep everybody from getting sick, period, with anything. So, I would focus on the positive. Don't let the kids hear you saying the negative stuff. That doesn't help them. But this is going to help keep you and your friends and your teachers healthy this year and that kind of stuff. So focusing on the positive, getting them used to it. And then from the standpoint of social distancing, on occasion, if you are out in public, you can kind of give them a guideline of what 6 feet really looks like. I think it's going to be harder in school for kids to truly be social distance. And that's why the masking is probably the most important thing. I find probably most parents are pretty good. They've taught their kids to wash their hands after going to the bathroom. I see parents all the time, even before the pandemic, pulling hand sanitizer out. So just again, emphasizing this health keeps us healthy and well, focusing on the well-being piece, focusing on the positive, as opposed to, this is a pain. Yeah, it's a pain, but we can focus on the positive with the kids and make them feel good about it, make them feel good for helping the people around them, helping their friends, helping their teachers, helping people stay safe and well.
The classroom and the school experience looks a lot different since COVID. For kids who did the remote learning last year, which is a lot of the kids, most of them, How can parents help them prepare for these changes in the classroom?
So I think one of the differences is going to be a morning routine, right? You're going to have to get up and get out of the house. And I was sort of teasing a teenager last year in a very friendly way, but I said, and part of it, we were talking about activity levels and she, had gained just a teeny bit of weight and wasn't anything bad. But I think in COVID, a lot of people just weren't moving as much. And I said, before the pandemic, you got up, you went to the school bus, you walked around the classroom, around schools. This is a teenager. I said, now you roll over and open up your laptop. And she laughed. She said, yes, that's true. So I would say a good week or so before school, you want to get them into that routine of getting up at the same time, going to bed for your school nights. And even on weekends, bedtime shouldn't be that much different than school nights, but a nice routine where things are kind of the same so that first day of school, it's not chaotic. If they're younger kids and maybe they don't exactly drive them to the school or, walk them to school just so they can see the building again, that sort of just getting them used to the idea. But I think probably the key, because you can't be in the classroom practicing being in a classroom, but the key is starting to get this times of, bedtimes moving up to earlier in the evening. And most school age kids really need probably close to 10 hours of sleep. Once you get to maybe junior high school, it can be expanded to the 8 hours, and again, physical activity is always a good thing. So I'm finding times in the day where we're getting them off the screens because they have been on screens so much of the last year. And not on a day like today when we're doing the interview is super hot, but getting outside when you can. But again, I think that the bedtime routine, the morning routine is probably the best way to get them ready to be ready to learn in the classroom.
How can parents help prepare their kids for the extra COVID safety precautions that the schools might be implementing, such as wearing a mask or social distancing or the extra hand washing?
Yeah. Again, I think keeping it positive, practicing with the younger kids, especially emphasizing with the mask to cover the nose, because that's where the germs are, is right on your nose. So just covering your faces, and maybe if a mask is uncomfortable, trying out a couple different kinds of masks to find out. I've seen on moms groups on Facebook and things like, what's the best place to get a mask? Which one works best for your kids? So maybe trying out ahead of time a few different masks. Maybe when you're doing the school shopping, having them pick out a hand sanitizer that they like the smell of, or things like that. They can make it more fun and more enjoyable and less of a chore, less of a burden. Again, maybe with the masks, picking out a fabric that they like, or going with their favorite color if you can. But again, finding out what's comfortable around the ears. Some of them are a little more snug. If you can find one with adjustable ears, that might work better. And that type of thing to just see what works best. And you may find that with each of your children, you need to do a little something different in terms of those things. You can make games out of guessing how far 6 feet away is to help them to orient to what that means. Get a tape measure and go, how far away do we think that tree is when we're on a walk, or stop where you think 6 feet is and measure that, and maybe help them get used to what, because honestly, my husband's 6 feet tall. So I try to go, well, if he was laying on the floor, how far away would that be? As in terms of the 6 feet.
Good ideas. I love that idea. And finally, after kids have started school, what should parents do if their child's having a hard time adjusting at school?
So I really think, like I mentioned in previous questions, was, a good bedtime routine, getting adequate sleep is always going to help with regards to just feeling good in general. But an additional thing for, having a bad day, family dinners are a really good way to touch base with your kids. If you can sit down at the end of the day and eat together for 15 minutes, turn off the TV, focus on what's been good about the day, maybe what's been hard, think about if it has been hard, problem solving for the next day about, oh, my mask was really bothering me. Well, can we adjust it? Can we do something differently? Can we try a different mask? Or I'm worried because my friend was sick and they're not there today, and I'm worried that they're going to get sick, or they heard about somebody's parent being in the hospital or things like that. So that family dinner, and even aside from like the pandemic, a family dinner can be awesome from the standpoint of there's evidence that kids who have a regular family dinner at least 3 or 4 times a week, 15-20 minutes, where they sit down with the family, again without the TV, and can talk that they have fewer high-risk behaviors in the teenage years, we'll put it that way. But having that connection with your family, I think, can really build resilience and can really help the kids to get through those difficult days.
I love it. Well, thank you so much. This has been Healthful Conversations with SSM Health. Dr. Heidi Sally, Flu Care Pediatrician at SSM Health Cardinal Glennon Children's Hospital. If you want any more information about that, head to ssmhealth.com.